Dr. Thelma Fernandez has Care First Direct. Hold on one second, okay? But because it's under Community Family Care IP, you cannot use the urgent cares in the Lancaster Palmdale, but we can change it to, let me see if Dr. Thelma Fernandez has Care First Direct though.
Ma'am, you say you are a supervisor, and I'm just curious, ma'am. I have called member services and expressed to them I would like to go to urgent care. When I spoke to the person, the representative at member services, she told me the only urgent care under my doctor's office is in Hollywood. And when I found my yes,
that is true.
Okay,
I can transfer you to another doctor that is under Care First Direct, not Dr. Thelma Fernandez. Since you're complaining about the doctor's office anyways, I can find you a doctor that way you could see the urgent care in the Lancaster Palmdale area. I can make that transfer effective September 1st. You have a doctor's appointment tomorrow, which is August 30th. You will be covered under Dr. Thelma Fernandez. So I can go ahead and do the transfer effective September 1st. Would you like to do that?
Ma'am, what I'm trying to get you to understand is when I asked for that option, I was not given that opportunity. When I was assigned to my first physician, there was no other urgent care I can go to, but only in Hollywood. Then they told me I had to schedule an appointment so I can be seen, and my best bet is to go to my physician doctor. Now, when I filed a complaint regarding that physician, there was no urgent care available for me, okay, when I tried to seek care. I had to wait till I had to schedule a doctor's appointment to see a doctor, and turn around, I had to wait till a whole month, which was from last month to this month to the end of the month to get a doctor's appointment. Once I spoke to the lady last week, to where she can schedule me an appointment for this month on the 30th. I already had the appointment scheduled for September 7th, and they scheduled it for the end of this month. But I also been arguing that I needed care after me filing a complaint against my physician. And no one had urgent care options for me. Nothing was given to me. But now when I have an appointment the next day, and I was waiting on Jenny, what was her name? Teresa, or last week, and she told me she was going to talk to the manager. Now, when I have appointment tomorrow, now I can get the urgent care facilities now?
Oh. No. Okay, so like I said, Dr. Thelma Fernandez does not contract with the urgent cares in the Lancaster Palmdale area. Dr. Thelma Fernandez does not have a contract with our medical group in the Lancaster Palmdale area. So, since you're complaining about Dr. Thelma Fernandez, I can help you find another doctor under Care First Direct. That way you could be seen in the urgent cares in the Lancaster Palmdale. But that is up to you.
Ma'am, I'm not complaining. I'm not complaining about the new doctor's office you guys assigned me to. I was complaining about the other doctors I had an issue with. I'm not complaining about this new doctor's office you just assigned me to that got changed a doctor's appointment from the 7th of September to the end of this month, which is tomorrow. I don't have no issue. I have not even been to that facility yet, ma'am. My issue was regarding that when I filed the complaint against that physician denying me care, I needed care then. And when I asked member services to help me, there was no opportunity to get any type of urgent care. So I'm just curious, today is so suspicious that I have an opportunity to see an urgent care in Palmdale or Lancaster, and I've been on the phone with you guys since last week. After they changed my doctor's appointment and got told I was supposed to get an earlier appointment, this lady didn't call me back. Now you have an urgent care the day before my doctor's appointment. That is so...
No. Ma'am, clarification. No, you cannot go to the urgent care. So again, this is confirmation that you cannot go to the urgent cares because Dr. Thelma Fernandez's contract does not have a contract with the Lancaster Palmdale urgent cares. That's why I explained. So you cannot go to the urgent cares in the Lancaster Palmdale area. But if you do want to, I have to make a doctor change.
Okay. And that's going to cause me delay, right, ma'am? And where this appointment that's for tomorrow.
That transfer, as soon as I can do it is September 1st. Unless you really want to do it, I can do it October 1st.
Ma'am, I feel that would disrupt the fact of me trying to get the care that I need, to try to get tested, to find out what's been going on with me. I feel me getting that type of opportunity was delay me again, and I've been waiting on you guys to give me this type of information. I've been calling you guys all this week, and now all of a sudden, the day before my doctor's appointment, even after I was told they were going to contact my doctor's office last week and talk to the manager in that office to try to get my earlier doctor's appointment this week currently, and turn around the day for my appointment, there's urgent care available, but I have to cancel. I have to change over. I don't understand that. Is why it's been told to me the day before my last day of my appointment being tomorrow to tell me this is my I can go to urgent care today, but I have to change my doctor. So that would interfere with my doctor's appointment. Do that kind of get where you get where I'm coming from? I waited a whole month, ma'am, to get this appointment to finally go in and be wait all this time and was told I cannot do walk-ins at my doctor's office, even if it's an emergency. And now the day before my doctor's appointment, I can get changed over to go to an urgent care and turn around to urgent care and tell me that I have to do my physician doctor and get a scheduled appointment. I don't get it. Why would be flipped up right now at the last minute? And I'm burning, itching, discharging. I need to see immediate attention, and this is what I go through when I try to seek care with my member service from Care First. I just got enrolled with you guys. This May, I just got enrolled. I had one incident with one physician. Now I'm having trouble with representatives, and now I'm being told different rules when it comes down to situations regarding wrongful doing or trying to get help.
Okay. All right. So,
And what is your name again, ma'am?
my name's Terry.
Okay, Terry, you are a supervisor, right, Terry?
Yes, I am.
Okay, I'm just curious how a supervisor come with that only option, and a member is dealing with a health care condition that's worsening her every day, and the day for my appointment, and I've been trying to get in contact with you that you have urgent care, but I had to switch physician doctors to get that opportunity, and I have been to numbers of urgent cares, gave me wrongful medication, and they tell me my best bet is to follow with my physician doctor, get a scheduled appointment, to get tests done so I can figure out how to turn a solution for my diagnosis. And you want me to go back to urgent cares to go back to the same thing I've been dealing with. I don't understand that. And they said my better option is to see my physician doctor to get a proper diagnosis, to get proper tests done, to get the proper medication so I won't get the wrongful medication. So go to urgent care and deal with the wrongful doing again, and I have an appointment tomorrow. I mean, do that make sense to you? I just want to make, I don't want to seem I'm tripping. I just want to make sure, do that make sense to you? Would you want to do that at the last minute? Have you wait a whole month to get an appointment and switch it over to an early appointment the same month, and then turn around the day before your appointment, switch over doctors, so now I have delayed services again?
Okay. Well, the only reason I was calling you really was because just to let you know that the complaint you filed against Virginia, we received it and that we have addressed it. That was the only reason I was calling you yesterday, but that was it.
And then today when I talk to you, you tell me you have an option to give me some help of receiving care at an urgent care. You have an urgent care in Palmdale and Lancaster I can go see today, but I've been on member services line all month trying to...
Miss Coleman, don't... Okay, so I told you that was... Okay, I clarified that, and I said, no, you cannot go to the urgent care, okay. And I explained that a lot of times to you.
But I'm explaining to you, ma'am, I have asked for that opportunity. I'm telling you...
I told you, Ms. Coleman, I told you that if... I apologize the first time that I told you that it's not... I would have to change your medical group if you want to go to the... If you choose. And you already told me no. So that's fine, Ms. Coleman. I apologize. You cannot use the urgent cares because Dr. Thelma Fernandez is only contracted with Community Family Care, IPA, and she's not contracted with Care First Direct. Care First Direct are the medical groups that we are affiliated with the urgent care in the Lancaster Palmdale area. But you already made that clear, Ms. Coleman.
But I wanted to let you know about my issue regarding care. When I asked for them type of services, how come I wasn't given that opportunity, ma'am, is what I'm stating to you. When I talked to management regarding my issue regarding care, she didn't give me that opportunity. And I don't understand when I speak to you regarding employee, you can give me an urgent care information. But when I speak to member services, when I have spoken to a management from Care First, no one else gave me no opportunity. So I was just confused that you had that opportunity, but that's what I was just only confused at, ma'am. That's it.
Okay, and I understand that, and I apologize. I don't know why they didn't give you that option. They should have.
That's what I'm asking. That's what I'm trying to get you to understand. When I switch over doctors, they didn't give me no urgent care opportunity options at all. Even with the other one, they told me when I was assigned to my first position that the only urgent care besides her office is in Hollywood, and I was trying to be seen before I can be able to go to that appointment, but they told me I had no options. So when I got switched over to this physician, they didn't inform me of urgent care other than my doctor's office, and I asked for seeing the urgent care. They didn't have none available for me. So when I speak to you, you tell me there's no urgent care assigned to this doctor's medical group. I wasn't told that, so that's why I'm asking you, ma'am, to get clarification of this situation, because I be told anything, and I want to make sure it's correct. So it's part of the policy, a membership. That's why I'm asking, ma'am.
Yeah. Okay. And I understand that now. So yeah, and I apologize for that. But if you ever decide to change, then we can go ahead and do that.
Yes, but I also want to address that y'all guys have ignored my health condition. You guys are only concerned about in protecting yourselves, and more than y'all trying to see me get care. And I feel that is poorly, unfair, and I'm dealing with a health condition getting worse, and all I can do is sit on the phone and talk to you guys about the same thing instead of me trying to get into a doctor's office like immediately, and I'll be prolonged and delayed and treated rudely and not getting proper information correctly. That's particularly regarding membership, as me being part of Care First, and I feel like you guys set your own rules, and you guys just tell me any random things to just give me the believe, and then turn around, I don't get no help. So that's why I've been recording, because I feel that you guys are not properly giving me the help that I need. I feel you guys prolong me. I feel you guys delay me. You guys don't help me, and y'all do things at the last minute to where there's no other solution but me go through errors where delay and receiving more care. So I just wanted to show my proof that you guys do tell me anything. I talk to you guys on a private line, and you guys just make up your own rules. So I'm okay with that. I record the whole conversation, and I'm going to hang up the phone because I feel that was not the way that should be done. And I feel that you guys should be investigated. So that was my need to do this today, was to record. I knew this call didn't pertain to getting care. It was more protecting you guys for employees than you guys was worried about the wrongful doing to me regarding physicians. And y'all only want to protect each other. So now I see it's not about the member. It's about you guys. So that's why I'm going to put this on YouTube right now. Thank you. Have a nice day, ma'am. You did not want to help me. And I feel like that was unprofessional. And yeah, you should, you too. And this is her number. This is her number. And her extension is 3370. 3370. And this is Care First. This is how they treat you when you trying to get care regarding the wrongful doing by physicians. And look how they lead me on to believe that she called me to address me about the complaint regarding the terror. But she just told me she had urgent care information for me. But I've been waiting on this opportunity since I filed the complaint last month regarding my physician. And they didn't have no opportunity. But today they have that opportunity. Remind you, my doctor's appointment is tomorrow. It's tomorrow. So why today you have an opportunity to give me some type of help today, but you didn't have ever since I filed the complaint, no one had nothing to offer me. But you can protect your employees. What type of Medi-Cal get these type of medical groups that help you, health plans to help you seek care, and this is how they treat me. I've been dealing with it with Care First, HealthNet, now I'm over Blue Cross. This is Blue Cross Health Care First. And now I'm getting the same attitude, same behavior I got before. Why? And then they make up their own rules and tell me things that they feel they can tell me, but it's not part of the membership. I don't understand it, and she's a supervisor. So I'm going to put this on YouTube because I would like someone to hear my cries out from help, because I'm in suffer from neglect, medical malpractice, lies, and I have to record everything I do because they tell the side of their story like I be argumentative, I'm loud, I'm not trying to I'm not trying to listen, I'm not trying to hear them out, I'm rude, and I just wanted to prove today was the day I showed that they do not help me. They pretty much just tell me random things like, oh man, we can't get you urgent care, you have to schedule your appointment with a physician, you had to switch doctors over, did all that. There was no urgent care available. I even spoke to management, and they still didn't have nothing for me. So now I'm doing this all over again, complaining, be on the phone, not receiving any type of available care to get seen the same day, right off the phone to go in and get care. But I can be on the phone with the health condition getting worse, talking to them, instead of me getting some type of help. I don't understand that. So this is me, again, have to record everything goes on because I have no type of legacy where I get type of help or my complaint regarding issues being addressed properly or investigated properly. I have to record. Yes. I have to record it to protect my rights, to show that they're not doing their jobs, they're not helping me, they just telling me any type of random, they just tell me any type of random thing not regarding the fact of care. They just pretty much just tell me anything. As you can tell when you listen to her, just pretty much, oh, I was going to help you go to the urgent care right now. Do you want the addresses? And then turn around, oh, your doctor that you assigned to did not have any urgent care underneath her medical group. And then turn around. When I asked for my other doctor's office before I canceled, that doctor, after they denied me care, only one was available in Hollywood. Now I have one available a day for my appointment. I don't understand that. I don't understand that. And turn around, the urgent care is not going to be able to help me. They're going to tell me to go back to my physician doctor, schedule an appointment, which I just did, and go through the same matter again. I don't get why would they do me like that. And this is my Blue Cross Care First, her extension 3370, and this is how they treat me when I'm trying to get help or complain about their rudeness, their representative, the lack of helping and caring for my health condition that has not been treated because of wrongful medication being prescribed for over 3 years, and they haven't done anything to try to help me seek any type of care after me being disenrolled from HealthNet to get enrolled in Blue Cross, and now they doing the same behavior activity that they were doing.